Good morning, everyone. I have been asked to give a little talk on Chinese medicine and acupuncture for the AANA Foundation, and I'm delighted to do so. My name is Ladan Eshkevari. I am an acupuncturist and a nurse anesthetist, as well as the current chair of the AANA Foundation. So we're going to begin with a little bit of history of traditional Chinese medicine, which is essentially where acupuncture comes from. There have been carbon-dated materials that have found that what we believe to be true, that acupuncture has been around for a very long time. Now, of course, before the current age of stainless steel needles, they used to use stones, what we believe are artifacts that were stones, also known as needle stones that were sharpened, as well as the more rounded stones, which are called the bian stones, and stones that were actually shaped like arrowheads that we think were used to cause bleeding, which actually is still one of the modalities of Chinese medicine and acupuncture. And then, of course, with the coming of Bronze and Iron ages, we've actually found bronze and iron needles that we believe had been created to do traditional Chinese medicine and acupuncture. And then, of course, nowadays we have stainless steel, gold and silver needles, and these all have a variety of uses. And at the end, I will demonstrate some of the needles that we use currently. So as far as traditional Chinese medicine and how it came about in the US, is that in 1971, when Nixon actually traveled to China, the paparazzi that went with him, one of the reporters was James Reston, who unfortunately ended up with appendicitis in a hospital. And he describes his treatment as both surgical, where they removed the appendix, but then also they treated him with traditional Chinese medicine for the complications, meaning the pain that he had afterwards. And so when he came back to the US, he was a reporter for the New York Times. He began to write about his experience, and the medical community actually took a great interest in what he had experienced. And they began to essentially work together with Chinese medicine practitioners, inviting them to the US and going to China to see how the Chinese actually do acupuncture. And so since the 70s, acupuncture has actually grown in popularity in the United States, and now it has been shown to be useful for a variety of things, and that's why a lot of the insurance companies are actually now starting to reimburse. So what is traditional Chinese medicine? Well, the basic principles are that the organs are considered energetic and not anatomic. So if you were to go to an acupuncturist and, for example, they tell you that you have too much liver qi and that they need to manipulate your liver meridian, that doesn't mean your functional liver like we see it in Western medicine. It's your energetic liver. And so the organs that are very important to the body in Chinese medicine energetically are considered to be the liver, the heart, the pericardium, which is considered to be its own organ, the spleen, kidney, and lungs. So those are considered the zong organs, or the more functional to your body, even though they're energetic, that their energy really is the master of your body. And then there are the ones that are related to those that are considered the fu organs, which are the gallbladder, the small intestine, the sanjiao, which is basically your upper, mid, and lower abdominal area, the stomach, the urinary bladder, and the large intestine. And so you notice that the main organs are related to one of the what we call main organs, or the fu organs. And so it makes sense that the liver and gallbladder, and even in Western medicine, would go together. But when you look at the heart and the small intestine, or the large intestine and the lung, you think to yourself, well, how are those related? But interestingly enough, in Chinese medicine, the energies of those organs are very closely related. And, to translate that to Western medicine, when in fact people have lung issues, smokers, asthmatics, COPDers, they oftentimes also have constipation or diarrhea or some GI involvement as well. And so interestingly, in Western medicine, we see people with lung disease have some large intestine problems. And in Chinese medicine, we've known this for a very long time, that the energy of the lung and the energy of the large intestine actually are very interrelated. And then the other principle, excuse me, in Chinese medicine is the meridians. The meridians are basically those that carry the energy from each of these organs up to the surface of the body, so that the traditional Chinese medicine practitioners or the acupuncturists can tap into the energy of these meridians and these organs to basically help the energy move along and cure problems. Another principle that comes into play in Chinese medicine is the principle of yin and yang, and then of course the 5-element theory, which we'll talk about each of those here momentarily. So the acupuncture meridians run all over the body. There are 361 points on the body. And again, they're used to access the energy of the organs. And we use those as treatment, but also for diagnosis. There are probably, I would say, about 50 or so to 70 points that most acupuncturists use more than any other points. These are supposed to be the more potent points on each of the meridians. And then each point actually has a specific function. And so of all the points in the body, we probably use about 50 to 70 more than any other points. And again, those points have very specific functions. So for example, the point pericardium 6 is very much used for nausea and vomiting. And in fact, if you're a scuba diver and you go to your local drugstore, whether it's Walgreens or CVS, and you go in the aisle, in the medicine aisle, you'll see that they sell these wristbands, and the instructions tell you that, if you're going to be on a boat, or if you're going to scuba dive, or you get nauseous driving, they actually give you instructions to place that wristband that has a little metal circle on it on your pericardium 6. And that essentially is to prevent nausea and vomiting. So again, points have different specific functions, if you will, and so we use those to diagnose as well as to treat, mostly for treatment. There is also a whole compendium on auricular acupuncture that has its own point system, and I'll tell you a little bit more about that in a moment. So here are the meridians, and this diagram is just to show you that they do indeed traverse your whole body, and everything you see actually here on the right side also traverses on the left side, so they are bilateral. Except there is a meridian that runs straight down the front of the body. It's called the conception vessel, or the Ren meridian. We use it a lot in fertility treatments, if you will. The side of the body also has lots and lots of meridians. For example, the gallbladder meridian, which comes all the way to the top of the head and to the temples, is used a lot for migraine headache pain treatments. And then on the back, you have all the different meridians as well. And then the one that goes straight down the back is actually called the governing vessel, or the Du meridian. And we tap into the Du meridian for a lot of pain issues as well. Here's an example of the points, and I wanted to show you specifically where pericardium 6 is, only because it's one of the most common points. And you see on the side here that there are some measurements. These measurements are not inches or centimeters. They're actually unique to Chinese medicine, and they're called the Chun measurements. It's spelled C-U-N, pronounced Chun. Chun measurements basically say that no matter who you are, from your wrist crease to your elbow crease is 12 Chun. And then in order to identify the points, we just divide that into 2. And then from there, we have, 5 Chun, 3 Chun, 2 Chun, etc. Usually about a patient's thumb width is 1 Chun. And the reason we do this is because if we were to use inches, for example, 2 inches above the wrist crease would fall somewhere very different on someone with long arms like Michael Jordan versus on me. And so rather than using measurements that are specific, we use measurements that are specific to that human being's body. So that's why every body, no matter what the body is, has 12 chun between the elbow and the wrist crease. And then that's how we identify the points. And then this is just to demonstrate that we do have points on the body, and everything that's on the right is also on the left. And these are points of the stomach meridian. That's why you see the ST next to the numbering. The concept of yin and yang, I touched on it a little bit, but basically it talks about the fact that it's two opposing principles. I sometimes explain it to the medical students when I teach this to them at Georgetown, is that basically the way you think of yin and yang is almost like the sympathetic and parasympathetic nervous system of your body that work together in conjunction with one another, innervating all the organs, and yet opposing one another in a way. So they work together and oppose one another. That's the closest thing that I can give you an example of in Western medicine. But in Eastern medicine, we call it yin and yang. And the yin side is more kind of the stillness, cold, nighttime, and responsible for the main organs. And the yang of the body is more like the day, the movement, the heat, and the fu organs, or remember, the supporting organs, not the main organs of the body. And again, these two are opposing principles, but they work together and complement each other. And then this is a diagram. You've all probably already seen it, but it basically depicts the fact that they oppose each other. They're different colors, if you will, on a diagram, and yet they work together in conjunction, and there is always some yin and yang, and vice versa. The 5-element theory basically ascribes the elements, the 5 elements on the planet, to 5 of the 6 main organs. And so the characteristic of wood is given to the energy of the liver, and the heart behaves more like the energy of the fire, so on and so forth. And these organs basically control and support each other. So here's a diagram I drew of the various elements. And so you can see here that the wood element supports fire. So if you don't have wood, and by basically setting wood on fire, you get fire. And once you burn wood with fire, it turns into ash and basically supports the earth. And the earth is actually where we mine a lot of our metals and ores. And metals are found in a lot of water, bodies of water. And then of course, without water, you wouldn't have wood. So the outer circle are basically supporting organs. So the liver energy really supports the heart energy, and the kidney energy supports the liver's energy. And so you can see the body is interrelated. The inside arrows are actually controlling arrows. So in order to put out fire, you need more water. So if someone comes and they have a lot of heart fire issues, energy issues, then what we do is not only work on the cardiac meridian or the heart meridian of the body, but we also put needles in the kidney meridian to help tonify the kidney meridian in its job to control the fire or the heart. So here are the elements. Here are the organs related to those elements, both the yin organs or the main organs and the yang organs or the fu organs, the supporting organs. And then this is basically the, interestingly, the characteristics ascribed to this. So the 5-element people, practitioners, I should say, are prevalent in Europe. The Europeans really like the 5-element theory of acupuncture, and they use it a lot. The traditional Chinese medicine practitioners, we do use the 5-element theory, but we overlay it on top of all the other theories that I've explained, including yin and yang and the the meridians and the energetics. So it's a little bit more comprehensive. But there are people that just practice 5-element theory, and what they do is, again, relate the organs and kind of try to figure out which organs are out of whack. And if you go to a 5-element theory person and they tell you, well, you're much more of a wood person, you have a lot of wood energy, and therefore we need to control that, usually with the metal energy of the metal. Here, I'll show you the diagram again. Okay, so wood is controlled by metal. So if you have too much wood energy, then they would probably say, okay, you tend to get sick in the spring. You tend to have a very loud voice. You anger easily versus those of us that maybe, laugh more or worry more, or those of us that are more afraid. Those folks are more kidney energy. And so they basically work with the different organs to balance the energies of all of the energetics of the organs. So when you go to a Chinese medicine practitioner, they do some objective data. So, just like in Western medicine, we might have an EKG and a chest X-ray and an echo. In Chinese medicine, the objective data is that tongue diagnosis, pulse diagnosis, something called auricular diagnosis, where they actually look at the ear and kind of see what's going on with that. And then they ask a lot of subjective questions, just like we do in Western medicine. What are you having pain? Where is your pain? What's your sleep, diet, appetite? What's the main emotion you go to? Are you someone that tends to laugh more or worry more? And then we put all the data together and come up with a diagnosis. So this is my diagram of a tongue. To diagnose the tongue, you basically want the tongue to be light pink with a very light white coating. You want to look at the sides, which represent the liver, gallbladder energy. The middle represents the stomach, spleen, the back, the kidneys, and the front represents the heart and the lung. So for example, if you were to have a smoker stick out their tongue, you would notice that instead of a light pink, the tip of their tongue might be more bright pink or even redder. And that's because in Chinese medicine, we believe smoking to be a excess heat being brought into the body, and that causes the tip of the tongue, which is responsible for the heart and lung, which are the ones you're damaging by smoking, to be more red. So again, we use the tongue for diagnosis, looking at its condition, its color, etc. And then as far as the pulse, on the left, there are 3 pulses: the heart, the liver energy, and the kidney yin, which is the energy you get from your parents as an infant, or your mom and your dad as a fetus. And then on the right, you have the lung, spleen, and kidney fire energy, which is the energy that you have after you're born, and tends to be related more to sexuality. And so in younger people, this is a lot more bounding, whereas as you get older, it tends to become weaker. The middle one representing spleen energy, and the top one representing the lungs. This is a picture of the ear. I know it's a little crowded, but basically in Chinese medicine, we believe that you are, basically it's a picture of you as a fetus in your mother's womb. So here's your face and your head, this is your shoulders, and here are your legs tucked in, and these are your internal organs. And so we do use auricular acupuncture. There are actually some master points that are used a lot in terms of the ear. But as you can see, there are lots and lots of points that we can use. But again, just like body acupuncture, where we only use a handful of the points that we find to be more useful, it's the same thing on the ear. There's some very important points that we use. So for example, Shen Men is a point that we use. It's a calming point, or what we call one of the main master points. So what are the treatment modalities in Chinese medicine? Well, there's acupuncture, electroacupuncture, cupping, and moxa. So I'm going to tell you just a little bit about each one. So here's a young lady getting acupuncture. These are needles inserted into the meridians. This is the small intestine meridian. This is the bladder meridian, and this is that governing vessel or dew meridian. And you can see what we want to do is put the needles in at an angle, and we basically look for redness and reactions. This is an electroacupuncture machine. What we would basically do is connect the prongs, a negative and positive prong, to the two needles, let's say, and we would turn the machine on till the patient says they feel it. And that basically takes over rather than the acupuncturist's hands doing it. It's a more exact way of delivering the energy. This is cupping. It's kind of like a reverse massage. You basically cause negative vacuum suction in the cup, and it basically draws the muscle in. We use this a lot for muscle pain, tension, and even fever in some situations. And then this is the burning of moxa. Basically, moxa is from the chrysanthemum family. And we believe that the smoke from the moxa and the heat from the moxa is very tonifying for the body. So that's one thing that we can also use in Chinese medicine. Thank you for tuning in. I'm just going to demonstrate a little bit as far as some of the equipment we have. So here is an ear acupuncture needle. So I'm going to show you this. As you can see, it's very small and thin. And then here I have a regular, what we consider 1-inch acupuncture needle. And you can see these are stainless steel. They're individually wrapped. And so basically, here is what the acupuncture needle looks like. And as you can see, I don't know if you can see that very well, but they're not hollow bore like our needles. These are designed actually for the vessels to roll right off of them, and they're very thin. So this one is it's a 36 gauge needle of 1 inch. And then I'm going to show you a bigger one. So this is like for sciatica, sciatic pain. And again, you can see it's individually wrapped. I open it, it's sterile. And here is a longer needle so that we can access some of the deeper points. Okay. And then I do want to show you what a moxa looks like. So this is what moxa looks like. And this is a particular kind of moxa that we can actually put in a little vessel, little cup, insert it into the cup, light it, and the smoke and we would put it on top of the acupuncture point, and the patient would feel the energy and the smoke from the moxa, and hopefully address their issue in that way. And I'm going to see if I have a moxa cup so I can show you what that looks like as well. And yes, I have a different type of moxa here as well. This is a different kind of moxa. You can see, again, same thing. We would put it in like a vessel, put it on top of the acupuncture point, and burn that as well. So I hope this has been helpful in learning a little bit about acupuncture and Chinese medicine. Thank you so much for your attention.